I worked in local health departments in South Carolina in the Midlands for years. And in 2019, we were hit by a massive outbreak of hepatitis A. Hep A had spread across the Southeast and ultimately came to every county in the Midlands. With just a handful of staff, we investigated hundreds of cases and vaccinated thousands. We had no additional money, no additional support, just a commitment to do the best with what we had.
This is breaking news from Channel 7 Eyewitness News.
Several breaking developments tonight in the coronavirus outbreak.
And then COVID hit. I still remember our first case in Camden in Kershaw County. Within 2 weeks, the Kershaw County Hospital was overrun and undersupplied. We had no ability to test, no additional resources, and soon all the other area hospitals faced the same crisis. We talked to county officials, legislative delegations, and mayors, but all we could really do was pass on updates from the CDC. We were underprepared, understaffed, and unready. You know, most health departments never really recovered from the Great Recession budget cuts. Staff, programs, and infrastructure were left threadbare and dependent on Medicaid reimbursement and federal dollars. And today, both are at risk. On the one hand, you have rural health departments that can barely keep their doors open. And on the other, you have urban and suburban health departments that can't recruit and retain staff at a competitive salary. We hired 450 additional staff during the COVID response. Today, all of that additional capacity is gone. But throughout it all, I've worked with public health professionals across the South who are dedicated to their community. They vaccinate against measles. They prevent the spread of syphilis and tuberculosis. They help families access birth control and support new mothers. But today, public health is in peril. Budget cuts, staff layoffs, and mis- and disinformation are dismantling decades of progress and opening up the door to future pandemics. It's a horrifying picture, and it's one that left many public health professionals like myself feeling helpless. But eventually that sense of helplessness turned to purpose. And that's why I've launched the Southern Alliance for Public Health Leadership, a nonprofit dedicated to advocating for the essential role of public health in building healthier communities across the South. Through a coalition of passionate public health leaders, we'll build, unite, and empower the people, programs, and services that make up our public health system. We'll tackle 3 key challenges: declining vaccination rates, increasing infant and maternal mortality, and inadequate access to quality care. Public health is a backbone of our communities. It's time we fight for it.